diabetics are always on a lookout for new ways and means to manage their healthcare. And there are so many new applications which have hit the market these days which can help diabetics in this regard. E-hospitals is one such facility available to people who suffer from lifestyle diseases, and they have become extremely popular for two reasons. One is about the second opinion that they can get, and second is about meeting emergency situations. Today we have with us Dr. Devraj Shaw, who is a co-founder of Many Angels, one of the e-hospitals, to talk about the same subject, the advantages as well as the takeaways from e-hospitals. Thank you so much, Doctor, for being with us.
Thanks for having me here.
First of all, can you explain what is this e-hospital by definition? Because I guess the definition itself has changed so much over a short period of time. So what actually would e-hospital mean?
In a physical hospital, we have a physical building, and there are physicians who come there and see patients and disperse medications or conduct blood tests, etc. within the hospital. The challenge of a physical hospital is that you need to travel to a physical hospital. The hospital can't come to you. And therefore, by definition, a hospital will always be located in those geographical areas where there are a lot of patients available. In a country which is as diverse as India, if you have hospitals, so what typically tends to happen is you tend to have a lot of hospitals, physical hospitals, in large cities like Mumbai. But then you travel 40 kilometers north of Mumbai and there are not even small hospitals available. Obviously, doctors will be concentrated in those regions in which there are enough patients available, which typically means, again, the large hospitals. But India, as we know, does not live in its cities. It lives in its towns, it lives in its villages, it lives in the districts. And even in all the districts, can we guarantee in all 534 districts that we'll have one district hospital which will have all super specialities even by the end of 2040? That's not likely to happen. So as a result of which, the use of technology to deliver healthcare is a given. The use of technology by which the hospital will come to you instead of you going to the hospital is a given. And that's what an online hospital is, in which basically, instead of building a physical hospital, you have the cloud as a repository, and you are crowdsourcing doctors, and patients are reaching the doctors using technology such as a smartphone or the internet, which is mediangels.com.
Dr. Shom, you have actually touched a very raw nerve, because the biggest problem, especially for lifestyle diseases, is about accessibility. You know, especially in the tier 2 cities,
Sure.
tier 3 cities as well as villages.
Sure.
And the rush in the hospitals is so mad. You know. In that situation, you actually are trying to say that e-hospitals would help in managing the patients and their disorders through other ways, through alternative ways.
I'll actually take 2 steps back. I'll take 2 steps back and ask, are we certain as a nation that we will have a large hospital in every district in this country by 2040? Excuse me. And if the answer to that is no, then how are we going to serve a population which is already 1.2 billion and which will be 1.5 to maybe 2 billion by the end of 2040? So therefore, but at the same time, technology is ever expanding. About 800 million odd people have access to a mobile phone today. This will keep on expanding. 4G services will be available through the internet, such that 21 megabytes per second internet will be deliverable through the smartphone. I can sit in a Saharanpur in UP and order the same shoes which you can order in Mumbai through my smartphone. Why then can a doctor not visit me through my smartphone? So it's a given that we will not be able to solve this problem. Doctors are a rare resource. Any rare resource, unless you use technology in order to bring the supply and the demand curves together, you will not succeed in solving the problem. So you will have to use technology in order to solve the problem. Technology as an enabler and as a force builder or a force multiplier has been used even in India's general elections. So Prime Minister Modi, when he did the Chai Pe Charcha, what was that? That was actually, I cannot go to every city, every village or every district center. So I'm going to go ahead and use the power of the internet as a force multiplier and have people viewing me from everywhere. I'm saying, why are we not using that for doctors? Why are we intent on making the doctors available within a fixed hospital? Traffic everywhere is increasing. People are taking 2 hours to reach those hospitals. They're sitting 2 hours outside a doctor's cabin and they are not getting diagnosed. Sometimes going to a hospital makes you feel more ill than well, because everywhere around you there are more ill people. So why don't we use technology? Why don't we use applications? Why don't we use all of this to deliver online care?
Very incidentally, diabetics have been told not to visit TB hospitals as often as they
Sure.
should, because they are more prone for TB.
Sure.
Getting from the clinics.
Sure.
Okay, now how different will this situation or this facility be from the various new applications which are available on the phone?
MediAngels is not an application.
Yeah, true.
It's a concept.
Very true.
MediAngels is not about, so there are multiple applications which are available. These applications, let's say Uber as an application for cabs. I will not explain it with relation to healthcare, because I don't want to be speaking for or against who we consider as competitors, right? But let's consider Uber, right? What does Uber do? Uber goes ahead and it's an app which connects the cab driver on one hand with the consumer. Anyone can become a cab driver, anyone can be a consumer. The challenge that Uber faces is that none of the cab drivers are really ever going to be managed by Uber, or they are not going to be tracked by Uber, or their antecedents and credentials have not been verified by Uber. Which is why there's a reason why all the problems which have occurred with cabs have occurred with these app-related companies, whether that's Uber, that's Ola. That's happening because you're not able to verify and credential the drivers.
Sure.
So it's a technology company, as opposed to, let's say, a Meru which owns the cabs. In that sense, we are the ones who own the cabs. We are the ones who the drivers get, the doctors here get empaneled. We have a stringent Q&A by which the doctors become a part of this panel. The only way for people to get empaneled on mediangels.com is when people go ahead and when our ethics and quality assurance team goes ahead and thinks someone is a world leader in that particular specialty, and then they become a part of this. Especially in healthcare, yes, you need credentialing for cab drivers as well, as has been seen in the routine or the number of episodes which have occurred. But especially for doctors, credentialing is even more important. Because if you do not match, it's a life and death situation. It's a complex problem. It's not a simple problem like taking a taxi ride. What your doctor is telling you better be the best opinion, because if you're not getting the best opinion, then it's just a democratic referendum, right? In that sense, you're just going ahead and asking random people. Asking random people is worse than not asking anyone, because you'll be more confused at the end of asking random people. So it's important to match every doctor or every disease to the best doctor wherever in the world he may be. So in that sense, we are not really an app company, we are a lifestyle change, which is basically an online hospital using all the tenets of a physical hospital but delivering via technology.
Yeah, Dr. Sean, that's quite relevant here, because the largest number of emails that we get from our readers, both our magazine as well as internet website, is all about seeking second opinion. That's where everybody, either in terms of cost, which is the largest number of the inquiries come through, or is about the possibility of having an alternative. For instance, if somebody has been told that you have to go for dialysis, people ask, is there an alternative than going for dialysis?
Sure.
Both for cost as well as the pain that people have to go through. So, what are your competitions before we get into actual benefits for diabetics?
We don't consider anyone in India as competition, because in India you have companies which are trying to be Uber. We are not trying to be Uber. We are trying to basically control and to drive the patient. We take responsibility for the patient. We are not just connecting doctors to you so that you choose the doctor and you're pretty much on your own. We handhold you to the disease and make sure you get the appropriate treatment. So we don't consider anyone as competition. With relation to your previous point, it never ceases to amaze me how much effort and time people spend on choosing a cell phone. You can ask anyone in the audience and they will go ahead and say, I open 3 websites, look at 3 places, they'll on their fingers tell you, right? This is the memory, this is the RAM, this is the screen size, this is what it is. But in relation to their health, why do people not think of a second opinion? It's really amazing for me, right? Then they will turn around and say doctors have gone ahead and performed surgery where unnecessary. Excuse me, who's responsible for your health? Are doctors responsible for your health, or are you responsible for your health? You're not partaking in your responsibility. You want someone else to be responsible for your health. That's not fair. Just like you're going ahead and buying a cell phone, you don't trust what the website is telling you, right? You do your own research.
Very true.
So why wouldn't you do that for your health?
Very true.
Are you trying to tell me that your cell phone is more important than your health is? So
no, essentially because these days there are also reports of how so many operations related to surgeries related to stents being overused, people being forced to take blood tests and various kinds of diagnostics. So
doctors come out of the rest of society, right? I didn't come from Mars, right? I'm from Earth, just like you are.
True.
If society itself is becoming more and more materialistic, such that money is the real god or the only god that people are considering, if politicians are corrupt, if architects can be corrupt, if civil engineers can be corrupt, if lawyers can be corrupt, there's no reason why doctors can't be corrupt. We come out of the rest of humanity.
Exactly.
Right?
Exactly.
So what has to be done is, so neither are all doctors corrupt, nor are all doctors gods. Please don't treat me as a god. I'm not interested in being God. I'm interested in being a service provider. I'm interested in being a human being. Just like you evaluate other service providers, just like you evaluate other human beings, please go ahead and evaluate me. There will be some amongst us doctors who are not honest. There will be some amongst us doctors who are crooked. There will be some amongst us doctors who are corrupt. That's no different from anywhere else in the world. That's no different from any other cell phone company. For instance, there are reports which are available in newspapers and various other websites of people who have ordered cell phones and got rocks. Right? It's happening everywhere. My only thing is, it is your health. You are responsible for your health. Please use your responsibility diligently. Please go ahead and make sure that you think about your health before you point fingers and say that person didn't care about my health.
Okay.
Yes, we did conduct a survey in MediAngels of the last 20,000 transactions of the patients that we had seen, and we did find 44% of these on a second opinion from our doctors were not really advised surgery. But there could be a selection bias in the data. Who was really going ahead and seeking a second opinion? People who believed that their primary doctors, for reasons best known to them, were either not good enough or were suggesting surgery for pecuniary or for commercial gains. These were the people who were seeking a second opinion with us. So there's a selection bias. Is this a trend which could be there in society? Sure, it is not only India. Even in developed countries, we have found that doctors go ahead and sometimes suggest surgery when none may be required. But that, sir, is occurring all across the planet. There are people who are going ahead and building bridges which don't last, etc. We just have to be very, very concerned about our own health. Take our own health into our own hands. How much does it cost to seek an appropriate second opinion? Even if I have to buy a cell phone, I go ahead and check another time on a website. Why not ask a peer-related doctor whether the surgery is really necessary, or there are better options for care? Maybe the guy I checked with could have other options and surgery may not really be necessary, and unnecessary surgery could thus be avoided.
Okay. Dr. Shaw, for a diabetic, with all the related health issues that they can have, either with heart, eyes, kidneys, diabetic foot, all kinds of issues. Almost all parts are affected by diabetes. For that, how much will e-hospitals help, like yours in case of MediAngels? How will that help a diabetic?
Diabetes is the complete disease, right? It's an incredibly nice disease to have because it doesn't let you go with any organ being normal. Before it kills you, it will kill your nerves, as you put it. It will kill your eyes. You won't be able to see. You will develop kidney problems. You will develop nerve-related problems. You will develop stroke. You could develop heart-related problems. Your blood vessels will clog, and finally it will kill you. So it utilizes your disease completely, which is the wonderful thing about diabetes. In a complex disease of this kind, you need to go to a doctor repeatedly. You will need to undergo blood tests repeatedly. What better way than to use technology to do the same? In fact, to the extent that there are lots of apps who are actually dealing only with diabetes. Let's say by 2020, approximately about 1/4 of this country will have diabetes in some form or the other. If that be the case, then using technology makes a lot of sense because it's absolutely obvious that all 1/4 will not be staying in the large cities or the top 8 metros. So therefore, using technology to deliver such that also the fact is, because it involves so many organs, you cannot just be going to a general practitioner or an internist. You will require an ophthalmologist who's a retina specialist. You will require a nephrologist. You will require a neurologist. You will require a neurosurgeon. You will require a cardiologist. You might require a cardiac surgeon. All of these specialities are not going to be available at your favorite neighborhood clinic or hospital. So therefore, usage of technology and usage of an online hospital is very, very important.
Okay. Doctor, there is also another big issue about diabetes, that is about meeting emergencies. In terms of an emergency like a heart attack or a hypoglycemic attack, how would e-hospitals help?
Online hospitals such as ours are at the present moment not equipped to deal with emergencies. We cannot deal with emergencies because honestly, if you're having a heart attack, please don't look at your phone and be looking for the app. It probably makes sense to be calling the ambulance and running at that point in time, right? But in due course of time, are there companies in the US which go ahead and integrate a 911 dialing with the app? Yes, of course. That is something that can happen. At this present moment, we go ahead and make it very, very clear to people that listen, if you're fainting, please go to the hospital because it might require physical examination to determine what the cause of your fainting is. So at this present moment, emergencies are out of our ambit. But emergencies make up only 5% of the cases. So 95% of the cases, and in any case, all 100%, if they were treated well, they probably wouldn't have become emergent in the first place. So can they prevent emergencies? Yes. But when the emergency occurs, should you be looking at an online hospital? No, you should be looking at a physical doctor.
The point is a little different here. With diabetes, it's always the responsibility of taking care goes to the caretaker.
Correct.
It's he or she who is managing, an elderly patient or elderly diabetic at home. So in that case, will the caretaker be able to access e-hospitals as a second opinion during emergencies?
Absolutely. The doctor can go ahead and seek a second opinion most definitely because it allows you the ability, and 25% of our consults come in from doctors seeking opinions from their peers.
Yeah.
Because
Especially
that's the greatest validation of the model, right? If the doctor believes that someone else who's a part of this MediAngels network probably is going to answer it better than what he knows, it's probably a great